to you, if you wouldn't mind, if you have questions, you'll see in the top right-hand corner of your screen, there's a little kind of bubble, and that is the chat box. My colleague Jane Gribben will be monitoring the chat box throughout and will help us sort of pick up any questions. So if you have specific questions for any of the presenters, feel free to put the questions in the chat, and then we can discuss those later in the session. It is good if you can mute when people are speaking, because it does give you a bit of reverberation if that's the case. So we're just going to get underway here now. I suppose one of the things that has kind of driven us to doing these sessions over the last number of weeks is just that the world we know has completely changed, and the way that we did things before in lots of different volunteer roles will not be the same and will not be available to us as we go forward. And one of the roles that we've been, I suppose, particularly aware of is the issue around volunteer driving and how you manage to do it in a potentially safe way, and what measures you would need to take to make that to be the case. So we're very pleased this morning to have 3 speakers, and what we will do is hand over to each one of them in turn. And then following the speakers, we will take questions immediately for Linda, because she can't stay with us very long. But then after Tim and Malcolm have spoken, we will have a broader question and answer session. So there'll be opportunities for questions excuse me, and discussion. So our speakers this morning are Linda Buick from the Department for Infrastructure. We have also Tim Cairns, who's the Director for the Community Transport Association in Northern Ireland, and Malcolm Stewart, who's the Lead Manager for the non-emergency transport within the ambulance service. I hope I've got all those titles right, because I'm doing them from memory, so apologies if I've made a mistake. So without further ado, I'm going to mute myself, and I'm going to ask Linda if she would like to start the presentation this morning. Thank you, Linda.
Okay, thanks, Denise. Yes, hi everybody, and thanks for the opportunity to come and speak to you today about the Department's Safer Travel Guidance. This is currently under development, and we hope to issue it in the near future. So it was developed in line with similar guidance in other jurisdictions, and it will form part of the executive suite of COVID-19 guidance. And in that, it will be part of the preparations for progress towards recovery, and the intention is that once it is released, it will be updated as appropriate as we move through the executive's recovery plan. So the guidance itself, we have developed two different guidances documents. The first one is Safer Travel Guidance for Passengers. So while it's for passengers, organizations could use it and adapt it for their own purposes if that, would be helpful. So the guidance provides advice to passengers on public transport and those walking, cycling or driving. And although, we're kind of moving into the stage now where restrictions are easing and there are less constraints on our movements, the advice remains to think before you travel if your journey is necessary. And also, how easy it will be to maintain social distancing, not only on your journey, but also at your destination. The guidance for public transport operators is about keeping staff and passengers safe, and so there's important safety information in it that all organisations employing drivers and using volunteers can benefit from. So it has advice on issues such as conducting a risk assessment and measures to keep your workers and passengers safe, and also the importance of considering the needs of others, such as older people and people with disabilities, when considering these measures that you need to put in place to kind of keep everybody safe. And I will run through some of the key messages from the guidance shortly. So where we're at with the guidance, well, we had a short informal consultation a couple of weeks ago, and we've taken the comments from consultees into account. And we were intent on issuing the guidance soon after the consultation, but as you know, things changed, and unfortunately, it hasn't been released as yet, but we're hoping that towards the end of next week, we will be able to get it out there. So the guidance is strategic, and it is, I suppose, the operator guidance is applicable to public transport operators. But, there are some key messages and principles that may be helpful, when you're considering the specific arrangements for your own organisations. Like, I know that you have unique challenges in ensuring that volunteer drivers can continue to deliver, the important services that you do in a safe way, and as restrictions on travel are lifted. And so I've tried to pull out some of the message that may be of most relevant to you. But ultimately, it'll be for each of your organizations to kind of look at this and see what you can implement and what is the best safety procedures to put in place for your own organization and based on your own kind of unique circumstances and the services that you run. So some of the key messages from our guidance are that you should carry out a risk assessment on COVID-19 in your workplaces. So as you know, risk assessment is about identifying measures to control the risks in your workplace and the service you provide. And I'm sure you already have these in place, and you possibly already have them updated about the impact of COVID-19. But it's just about, I suppose, reminding people of the importance of risk assessments and the need to have them in place and to take account of the specific risks and the COVID-19 brings, and some of the measures that you're putting in place to deal with this and the impact that they might have. And so when developing your risk assessment, you'll want to engage with your volunteers and also to share the results with your volunteers. And you want to give consideration to the risks posed to your staff, your volunteers and passengers. And also just to be aware that certain groups are potentially more at risk from COVID-19, such as Black, Asian and minority ethnic men over 55, older workers, pregnant women, those with an underlying health condition and people with disability. And, the Health and Safety Executive has a blank template and can provide further advice and assistance in completing and recording a risk assessment if you need it. So the current guidance is for people to maintain 2 metre social distance from others. I understand that this is being considered by the executive. I know that in England they have moved to change the advice on that, where it should be kind of 1 metre where there is other mitigations in place. But for now, we are working to maintaining 2 metre social distance from others, and that includes when on transport. So, I recognise that that's going to be difficult in community transport vehicles, and, given the demographic and health needs of your passengers, you may need to assist them on and off vehicles. So in that case, it'll be important that other procedures are put in place to manage the transmission risks. So for example, trying to keep the time you spend in close proximity to others as short as possible, and maybe increasing the space between the driver and passenger where that's possible. So for example, maybe have the passenger sit in the back left-hand side of the vehicle, limiting the number of passengers to 1 if that is possible also, and cleaning vehicles in between passengers and having hand sanitizer on hand for passengers. And social distancing isn't just between staff and passengers or volunteers and passengers, it's between staff themselves and volunteers themselves. So it's not just in the vehicle, it applies to all parts of your organisation. So that includes maybe office buildings, depots, or anywhere, where the drivers or volunteers might congregate. So as well as social distancing, hygiene is the other most important measure for reducing the risk of transmission. And so our guidance recommends that operators put in place procedures around cleaning, washing and hand sanitizing. And so it recommends frequent cleaning of objects and surfaces that are touched regularly, including, door handles, vehicle keys, and making sure there are adequate disposal arrangements for cleaning products. And if, drivers are sharing vehicles or, doing one shift and then somebody else is taking over, that all needs to be taken into account, and vehicles cleaned and car keys cleaned and handles and steering wheels and all that kind of thing. Yeah, and when these processes are being put in place in different measures, you'll need to make some adjustments for maybe disabled people, older people or young people to help ensure they can travel safely. And so it'd be important that this is communicated with your passengers in simple, clear messaging, and so that they understand what new procedures might be in place, what will be required of them, what they can expect when they are using your service, and to consider the range of needs that they will have. Some of them might have English as their first language, some of them might have visual impairments and need additional assistance. some of them mightn't have hearing impairments, and so you might want to consider the use of clear visors by volunteers, because some of these might rely on lip reading to communicate. So you might also want to consider a cohorting if that's an option. So that's really where, the same group of people work together. So you're kind of setting up fixed teams or partnering. So each person works with only a few others, and they stay in that group, for all shifts or whatever. And that, I suppose, just reduces the risk of transmission and keeps it contained to those certain smaller numbers. So on face coverings, you may be aware that our minister is considering mandating face coverings in public transport for passengers and staff. So when I'm talking about face coverings, I'm talking about, cloth coverings rather than surgical masks or PPE. So the evidence shows that face coverings can protect other people rather than the people wearing them. So in that case, if a driver is wearing face coverings, the driver themselves won't be protected, but they are offering protection to the passengers. In your services, it's, there's going to be some exemptions for people who wearing face coverings wouldn't be appropriate or suitable because of their needs. And so it might be the case that a lot of your passengers would be exempted from wearing face coverings if it was to be brought in to be mandatory. And so, your driver isn't going to be protected because other people aren't going to be wearing face coverings. If they wear a face covering, it's not going to protect them. So your risk assessment in that case might suggest that drivers need PPE rather than face coverings as a protective measure. So that's kind of an overview of our guidance. Just to note that the UK government has developed guidance on working safely within or from a vehicle. So that advice only applies to England, but it might be a useful reference, if you're looking for your own organisation and what its needs are. I understand that the DFE are looking and considering whether similar guidance should be developed for Northern Ireland, falling out from that, but I'm not sure whether that's going to be taken forward or not. So as I said, we hope to issue our guidance towards the end of next week, and I can send a link to Denise, once that's issued, that she could circulate to everyone if that would be helpful to you all.
Linda, that's really great. Thanks very much for that. And I think if you do could send me the link, that would be lovely, and I'll share it with everybody who's booked on to this session this morning. That would be really useful. So thanks, that's much appreciated. Okay. Just before, I know Linda has to go, and she's already stayed beyond her time, so I appreciate that. I'm just wondering, does anybody have a quick question? Anybody want to unmute quickly with a quick question before we move on to Tim's presentation? No, I'm here in silence. Linda, you're off the hook there. Thanks very much. We really appreciate you joining us this morning. So thank you.
Okay.
We'll look forward to getting guidance next week. Thank you.
All right. Okay. Thank you. Bye.
Right. Thank you. Bye. Okay, Tim, we're over to you now for the next bit of the presentation. Tim's going to set the context about the framework that's being developed by the Community Transport Association, which is a UK national body. So Tim, the floor is yours.
Thank you. I don't know if Julianne got my presentation or not. No?
Sorry, I'm still talking on mute. No, I checked with her just before and the presentation hadn't come through.
Okay.
Sorry. I want to share your screen because we can do that. I mean, Julianne can do that. So if you tell us when you're ready.
Yeah. Let's see. So, are people seeing that now?
Yes, we are seeing that, Tim. Yeah. Do you want to?
No, let's see if I can click that down. Sorry about this. Wait a sec. Can't. There's a. Can't minimize down the stuff here to make the presentation full size. Anyway, I can't get the right-hand side of the screen. Anyway,
I think we can still see it, and if you want to, then if you circulate it to me afterwards, I'll email it around the participants. So don't worry about it too much. If you want to just go through it as it is, that would be lovely. Thanks.
Okay. Well, just a lot of what has been said already I'm just going to cover in a wee bit more detail, because we've been working up some guidance ourselves in terms of the Community Transport Association and the sort of things that we're going to look at going forward. I think we've got the presentation working there now. So just very quickly, where we're at and how we got to where we're at with all of this. In around mid-March, the start of April, when this whole pandemic started, we issued a suite of guidance documents at that point in time in and around how people could safely offer essential travel at that point in time, how people could pivot to new ways of working in terms of deliveries and those sorts of things. And a lot of guidance is still relevant, because I think we're going to still do a lot of those things that were new ways of doing things. Now, we've moved on from that stage, and we're looking now at how we can help our members and help all of you who are running transport as part of your charities and operations, to help you see how you can merge the off-air transport again over the next couple of months, next couple of weeks. Looking at vehicle adaptations, looking at accessing support funds, looking at risk assessments that we've been talking about. We'll look at in a wee bit more detail in a few minutes, and how to keep passengers safe. Then I think we're going to move into a final phase beyond that, where we're going to look at how we can keep up with the fast pace of change there's going to be. I think what we're moving into is going to be a new normal, as people say, and it's going to be with us for quite some time. So how can we keep up with the fast pace of changes? How can we move forward when we're able to move forward? When are the right times going to be to move back? And maybe go back into a phase where we're offering more limited services. So it's going to see, how do we care about things in a different way, and we're going to be looking at how we do that, how we continue the good things that we've been doing over the last number of weeks that have been different things that we've been doing. So how do we continue to do those and also then ensure that people are safe as they travel and as they access the transport that they need. So seems to be stuck. Here we go. So what we're looking at is how do we recover and restart? That's the phase that we're in now. How can we make people feel secure? And I think it's really all about that. How are people, whether they're paid staff or whether they're volunteers or whether they're passengers who are using the service, how do they feel secure when they get into that vehicle? What can we do to ensure that people feel that their needs are being protected, whether they're staff or whether they're volunteers or whether they're passengers when they get onto those vehicles? And I think the big question we've got to answer is, what are the rules? A lot of the legislation is going to become guidance, it's going to become advice as we move forward. So how do we maintain the letter of that advice and that law, whilst also maintaining the spirit of that law, and give that confidence about safety to travel? And how are we going to reinstate the services? How are we going to look at the destinations that we're going to, hospitals, taking people for exercise, taking people to see family members? How are we going to, how are we going to reinstate those services in a safe way going forward? And what we're focusing on in CTA is advice and guidance, and we're focusing on ways of delivering different types of services to different types of people as we move forward. And then I think what we're going to move to after we've done that initial guidance is into a sort of a phase of consolidation and strengthening. How can we cement these new relationships that we've forged over the time that we've been doing things differently from mid-March to now? How are we going to make sure that there's more collaboration? I think what we're going to do is we're going to move from guidance to help people tell stories. I think there's going to be a lot for us to learn as we try and do things in different ways. There's going to be a lot for us to learn from different parts of the UK and different parts of Ireland as well as we move forward. And I think what we're going to try and do is not just produce guidance, but try and help people to see the stories of other people in the third sector across the UK and beyond as to how they're doing things differently, and try and match people up with stories. There's going to be things happening in the Scottish Highlands, or there's going to be things happening in central Manchester that are going to be things that you've maybe never thought about, that you could replicate or could help your services run differently or better. So it's not just focusing on guidance, it's focusing on working with peers to build a much stronger voluntary sector to raise the profile of work that is really making meaningful impact in other places. That could be something that you could develop and deploy. Now I think we move from there into reimagining. How can we help better collaboration? How can we help the sector to build better? How can we help to frame new aspirations? But it seemed to me that over the last few weeks, what we've really come back to is this notion that collaboration and a commitment to community and collaboration is what's going to be important. And I think we've really seen the community coming together, and we've seen people from different walks of life collaborating together. So how can we continue to maintain that collaboration between not just the third sector, but also third sector and private sector organisations? When you look at the great efforts that there have been in terms of food delivery and all of those sorts of things, great more synergy between district councils and those of us who are providing transport. How can we continue to ensure that that collaboration goes forward? Well, as Denise said, we're in the recovery and restart phase at the moment, and what we're at is guidance. Whilst we want to get to the sharing of stories and building better collaboration, I suppose we're at phase one, which is the building blocks of what guidance looks like, guidance for passengers, drivers, and guidance for operators and organisations. And I think the key questions that we've been examining are in and around risk assessment that Linda's already been talking about. What constitutes an essential journey? How can social distancing be enforced in smaller vehicles? What modifications need to be made to vehicles to ensure that they're safe? And I think really, what should drivers and passenger assistants be doing to make sure that they're staying safe as they're helping passengers access key and essential journeys over the next weeks and months? Well, risk assessment, I'm not going to dwell too long on this because Linda's already covered most of it, but I think an important thing to say is your obligations haven't changed under existing legislation. The way you did risk assessments before is the way you need to continue to do those risk assessments, but you need to update them and do them again in the light of COVID-19 and the likelihood of infection and transfer in COVID-19. But I think there's also some other practical steps that you need to take in terms of updating risk registers and documentation, ensuring that your trustee board are fully aware of what you're doing. And I think if anybody's a trustee here, I think you've got a very important role in all of this of interrogating what's happening to ensure that there's operational safety. And I think what we need to be ensuring is that instructions are given weekly or daily, that there's clear, there's frequent, there's direct communication with your volunteers, with your staff, with the customers and passengers and users of your service. And I think it's really key that those risks are communicated, and what you're doing to mitigate those risks is communicated effectively and often. So what should be in your risk assessment? And Linda's already dealt with this, so I'll not dwell on this for too long. Obviously, as Linda said, there are groups that face greater risk. What are you doing for them? What about older volunteers? You know, we're getting a lot of queries at the minute where people are older or in more at-risk groups, and we're just trying to help our members to have those conversations with people about what they should and shouldn't be doing, or helping people understand that they can volunteer in a different way, and helping people to pivot to new ways of volunteering, whether it maybe is in the office rather than driving a vehicle and doing other things, or you know, being part of friendship services where they can phone up people that they used to drive and speak to them and have that contact with them in different ways. And we're also then looking at things in and around PPE, what's required. Linda's already covered that in terms of face covering, but it's all other PPE that your drivers and your staff are going to need. But we need to ensure that there's general passenger well-being. We need to make sure that that the needs are being met. And I think what we need to do is transport is the key building block to ensuring that people don't become lonely and isolated, and ensure that people are, don't have exacerbated health problems going forward. Driving and transport is the front line. It's often the forgotten front line in many services, and when many government programs are being brought forward. Actually, how you get people from their home to that service is often the neglected part, and it's not often thought about. But I think we need now to reverse that and arrest that thought process within government departments, that transport is the key, is the main, is the foundational building block. So big question I think everybody's asking is, what is essential travel? Well, I think, you know, we've moved now into phase 2 within the Northern Ireland Recovery Plan, and in phase 2, we're getting to the point now where TransLink are saying that non-essential travel can take place within public transport. It's important to remember, however, that transport under a Section 10B permit or transport under a volunteer car scheme is not public transport. And I think it is important, because of the classes and the groups of people that are being taken in that type of transport, that I think we're still in the phase where it's essential journeys only in terms of shopping, medical needs, and exercise purposes. We're recommending in our guidance when it comes out, and that should be coming out probably tomorrow or Monday, we're recommending face covering as a condition of travel for those who need to use face covering. I think it's going to be very difficult for those who can use face covering. I think it's going to be very difficult to get transport back in a car or in a minibus without that sort of level of universal face covering. And then, as Linda's already said, you know, it's hand sanitizer, it's that cleaning, and not only is it clean, it's hygiene for passengers, but also the vehicles. Vehicles need to be sanitized after each trip. It needs to be clean, 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 clean. Seats, handles, grabs, seat belts, wheelchair handles, all need to be cleaned. And I think, you know, if there's any ways that you can adapt vehicles, particularly I'm thinking of minibuses, where you could have perspex screens between passengers and drivers and seating areas, the removal of seats, taping off seats in minibuses are going to be things that are going to be very important to do. I think also then in car schemes, you know, we're going to have to look very carefully at how volunteers are following a proper sanitization process. How do we ensure that after each passenger gets out of the vehicle, that the vehicles are being properly sanitized and cleaned? And I think there's going to have to be a level of training. I think you know, we're going to need to show volunteers how to do this and ensure that each and every time when people are getting in and out of those cars and car schemes, that the cars are being cleaned. Now, passenger assistance, I think this is really the key, is how do we get people in and out of vehicles? And this is the key question that we've been really wrestling with in community transport, because the vast majority of our passengers require quite in-depth and quite detailed assistance to get on and off the vehicle. So it's how do we do that? And these are some of the things that we're going to be looking at in our guidance that's coming out over the next couple of days. You know, is wheelchairs, is that a way that we're going to be able to get people in and out of the vehicle more easily in terms of a minibus? I think in terms of car schemes, it's going to be how do we limit the very close contact that's going to be required to get people in and out of the back of a car. And I think, you know, it's how do we prompt passengers to sanitize hands on boarding, to ensure that they're protected in the PPE that is being offered by the organisation, and also the PPE that they're having to wear themselves. So those are really the key things that we're going to be looking in terms of passenger assistance. But look, every situation is going to be different. Every passenger's needs is going to be different. I think, you know, for all the passengers that you're looking to get on and off your vehicles, there's going to have to be many risk assessments done on each passenger, and many risk assessments on how you can safely get them into the vehicle, out of the vehicle, and get them to where they need to go. Now, these are my final thoughts, and I've tried to keep them all to C's as best I can. I'm not sure if it really works, but clean. I mean, it's just clean, clean, clean. If you have volunteer drivers and they're driving their own vehicle or they're driving a minibus, we cannot emphasize enough that everything needs to be cleaned. Every time somebody gets on, hand sanitized. Every time somebody gets off, places where that could be grabbed, the back of seats, you know, door handles, seat belts, all need to be cleaned. And I think, you know, you're going to have to go through a process of training with people to ensure that they're doing it. Then I think, secondly, we need to communicate what can and cannot be done. What is the law? What is guidance? What is advice? And I think we need to be very clear. So we need to have clarity. People, passengers, drivers, volunteers need to know what they can and they cannot do. And I think, you know, we need to make sure that drivers have checklists or whatever that is in the vehicle with them, so that they can clearly communicate each and every time what it is that needs to happen, how it needs to happen, and that needs to be done in very clear and very simple terms. And I think then you need to check that people are following those guidelines on cleaning, those guidelines on how to get people in and out of vehicles safely. But there's other things you need to check as well. Check insurance. I mean, if you've made a modification to a minibus, that could be problematic, and that could be something that would need to be notifiable to DVA so that you can pass your MOT when your vehicle comes to need that. So there are things, and also modifications insurance-wise. I mean, if you modify a vehicle, even if that's on a modification that's notifiable to DVA, it's still something that could invalidate your insurance. So whatever you do, so check insurance, check that the procedures you've put in place are happening, and check and ensure that everybody is clear and they know exactly what they can and cannot do. So if anyone's any questions, I think we'll take them afterwards, Denise.
Thanks very much, Tim. I think that's a really helpful overview, and we'll come back to questions for Tim at the end of the session. So I just wanted to mention in relation to older volunteers, just before we move on to Malcolm, that the Department for Communities through the NI Direct website has just put out it's not guidance really about older volunteers, but it's a general statement about volunteers over 70. We have linked that through to our good practice guidance on our website just this last week. Basically, the message from that document is really saying that while you can go out for those essential reasons that Tim has mentioned, if you're over 70, if you maintain social distancing to protect yourself and others, they are stressing that if you're over 70, you're at much higher risk of complications relating to COVID, even if you are essentially fit and well. So while they have stopped short of saying we don't recommend volunteering, I think what they're saying is ask yourself whether that's really necessary. And again, they have pointed to the options that people could potentially volunteer from home by doing things like telephone befriending, those kinds of things, or even volunteering outside is being suggested, so that you're not, if you're over 70, looking at indoor volunteering. So that guidance is there. It's on the NI Direct website. It's linked through from our information sheet. So if anybody wants to have a look at that, they're very welcome to do so. I'd like to introduce to you now Malcolm Stewart. And Malcolm's going to just give us a little bit of an overview about how the ambulance service have been coping with the driving issues around their non-emergency transport scheme. So Malcolm, you're very welcome. Thank you for joining us this morning.
Thank you for having me. I'd just like to say I don't have a fancy presentation or anything. I did send in just a checklist of what we're actually doing, but I'll give just a quick overview. So first of all, the Northern Ireland are volunteer drivers, and we really only deal with driving at a volunteer level for transport. And it's quite specific what we use our volunteer car drivers for, and that has advantages and disadvantages. The advantages are to design and create the new normal is quite easy because we only have a couple of boxes to check. The negatives are the fact that almost everybody we carry is high risk, because we take people to renal treatments and we take people to cancer treatments as well as some others, and they're all high risk patients, which is problematic. So we sort of did what everybody else did in March when we had to stand down all our volunteer car drivers, and we put people onto our non-emergency ambulances because they still had to go in with the social distancing, but it was easier to maintain that in larger vehicles. With that, and we used our drivers for sort of other purposes, delivering to keep them sort of in the loop as it were, but to actual patient we didn't have. After sort of much discussion and we did a risk assessment, we introduced our volunteer car drivers at the start of June, and part of that risk assessment highlighted specific things that we thought we would have to protect both the patients and the drivers for. Some of them have been mentioned before on the other presentations, but we sent out to all our drivers and made sure that we did a sort of a Occuhealth sort of questionnaire to make sure that they didn't have any underlying conditions. any of the high risk drivers we haven't used, and that cut our sort of capacity down to 50% for the 1st of June. So we only were able to reintroduce 50% of the drivers. We looked at our high risk patients that were going on and limited them, and we took guidance and we liaised with the renal units and hospitals and stuff just to identify the patients that we thought were suitable to go back into cars. The other thing we did was make sure that it was only confirmed COVID-19 free patients. So if they've been swabbed and cleared and there isn't any COVID-19, we allowed them to go in cars. If there was, they had to go in an ambulance vehicle. So we then identified all the cars with wipeable interiors for cleaning, because that's a big issue. And anything that didn't, we actually issued plastic seat covers to be disposed of after each run, and we mandated the drivers to use these. From a PPE standpoint, we issued PPE packs to all the drivers and mandated the use of them, which included gloves, wipes, surgical masks, and obviously the seat covers if they needed them, and we issued them to all the drivers. Then because of the type of patient we bring in, often like renal patients come in 3 times a week for 2 journeys, and cancer patients might be, for 2 weeks, every day for 2 weeks sort of thing. We were able to create transport bubbles, so that only one driver only ever has one patient, and that's the patient that's assigned to them for the duration of that treatment. So we don't have them sort of doing a different patient in the morning and a different patient in the afternoon. They only have the one patient, creating that transport bubble. Then we, and it's like every other thing that's been said today, it's about the basics: hand washing, car cleaning, car wiping down after each run. So what we did was we issued IPC information sheets to all our drivers. Now these give the sort of 7-step hand washing, how to decontaminate a vehicle, just guidance sheets for everybody to follow to do after each patient transport, really. So that's where we are now. We are now in the process of doing further risk assessments to try and expand the number of drivers, because a lot of our drivers, as I said, we lost about 50% because they're all high risk. A lot of our drivers used to come in with voluntary cars with renal patients, and then when they got to their transplant or whatever, now drive for us, but we haven't been able to use them. So we're only at about not even quite 50% capacity. So we want to expand that. We want to get them back on board, because it's very, well, financially, it's very expensive to, put these patients on other forms of transport. So we are doing that at the moment. We have other issues too that have cropped up, like because we tend to bring people into hospitals and stuff like that. There's the old issues about where do they, waiting times and how long. So we've had to be a bit sharper in our scheduling, so that patients aren't sitting around for a half an hour waiting for a car to come back. Again, it's all the social distancing experts, social distancing aspects, and a lot of hospitals, with the changes even with the hospitals and treatment centers, that's been very difficult to manage. So we've had to be sharper with our scheduling, not having people wait around for transport, and those sorts of things. So in a nutshell, we are coming back. I look forward to seeing all the other guidance that comes back. We used sort of national guidance when we decided on which drivers to bring back, and at that time that was issued. It was no underlying conditions. There was an age limit, that sort of thing, and they're the only ones that are back at the moment. But it's a work in progress. It's a journey that we're all on, and we hope to get back to expanding the service completely. I would hopefully by the end of the summer, and we should know more. I don't think from a social distancing standpoint, where that really was an issue for me within ambulances or anything, within cars, whether it's 1 meter or 2 meters, it's almost irrelevant in a car. And all our voluntary car drivers use cars for the ambulance service. So, you know, that really is, that's why we created the patient bubble aspect of things. Because I don't think we're in the near future, foreseeable future, that we're going to be any more than one patient or one person per car per journey. And that's really a rough overview of what we are doing and the part of the journey that we are on, along with everybody else. So thanks for your time.
That's really great. Thank you very much for sharing that. I think it's really inspiring to hear the process that you've been through. I'm just going to open the floor now for questions or comments. It'd be really lovely to hear anybody else's story, if anybody else has got a story to share, or if you want to ask either of our speakers a question. I'm just going to look along the line and see if I can see anybody with their hand up. No, you're all very quiet today. Paddy, do you want to? Oh, sorry, I see Paddy first and then Rosie. Paddy, you go first.
Sorry, I missed the start about the risk assessments. I was really struggling to log on. I have a laptop without a hashtag key, which caused me great pain for 15 minutes. But anyway, I'm on now. The key, the big issue for me is, and I mentioned it yesterday in a community transport meeting, is the personal assistance that we have to give to a lot of our clients is for me by far the biggest issue. We can go for the PPE, we can do our wipe down policies, and we can train our drivers as much as we can. But we have quite a few clients who require significant sort of physical support or guidance when you're taking them to and from the vehicle, in and out of the vehicle, and to and from their destination. For example, someone who's registered blind, who maybe a wee bit unsteady on their feet, that person is literally leaning on you from their door to the car and needs significant sort of hands-on help in and out of the car, and then they're leaning, holding on to your elbow and kind of, I mean, line up against you. But it's really, really close quarters for more than a few seconds. And I know we've talked about the PPE, I know we've talked about, you know, those procedures, but I still think with social distancing, that's totally against what any guidance would be on proper social distancing. It's really the same situation as providing personal care in a care home. You're in really, really close quarters. You are touching them, their clothing, they're touching you. So for me, that's by far our biggest concern. We can handle people who are wheelchair users. We can look after people who can sort of independently make their own way to and from the vehicle. They may need a wee bit of assistance at the door, getting in and out, or just a very brief, you know, sort of contact. But for me, that client who needs significant support is the really, really high risk one. And I don't know how we ever get around that if we follow the social distancing guidelines. It's either we just forget about the social distancing guidelines and put the client and the volunteer at risk, or we tell clients you can't go. But as I've said before, my big worry is front page of the Strabane Chronicle, EasyLink wouldn't take me because I'm blind, or EasyLink wouldn't take me because I need help. You know, that's what we're all about. You know, so that's the reason we exist. So for me, I don't know if it was mentioned at the risk assessment bit at the start, particularly, but for me, that's by far, I think we can handle anything else and everything else with what Tim had talked about and what Malcolm had talked about. It's all great advice and have been very useful. But for me, I don't know how we get around that really close quarters, hands-on contact for more than a second or two. And we have a number of clients like that need that amount of assistance.
I think that's a really useful question. I don't know, do Tim or Malcolm have any thoughts specifically on that issue?
I think just picking up on something that Paddy said, you know, wheelchairs are actually something where it's quite safe to carry someone. So I think a number of community transport operators are, if they have spare wheelchairs, are going to invest in that, because somebody like the type of person that Paddy's describing, who is blind, who would need a high level of care and help if you're going to actually get them onto the bus walking. It's you bring a wheelchair to the door and the wheelchair is sanitized, they get into the wheelchair, then you're not facing each other. and you wheel the wheelchair to the bus, and then their seat on the bus is that wheelchair. Now, I know that for a lot of people that's a problem, because they say, well, I don't want to be in a wheelchair. I don't, that's not something I want to use. But I think it's having those conversations. It's clearly communicating to the person that yes, you realise they don't need to be in a wheelchair. However, because of the government regulations, because of the advice and assistance, this is going to be the safest way for them. So I think, whilst there might be a resistance to that and a reluctance on that, it's coming back to what I said, is how you communicate, that there is going to have to be a different way of doing things. And I think, for those very highly dependent people, that may well be the way that they need to be transported, is in a wheelchair. But it's how to communicate that with them sensitively, to ensure that they understand that this is nothing about them and nothing against them, that this is just a way for them to safely use the service. So that's why communication is as key in all of this as is what you actually do. So I think that's certainly something that I think people need to consider. Now, I understand that, for organisations that maybe don't have spare capacity for wheelchairs to get people to and from vehicles, that's going to be a difficulty, and particularly in a car service, to get somebody in and out. There's still going to be some very close contact to be able to do that. But I think that's going to be a way of minimising the risk, particularly with minibus transport.
We had real challenges.
Thanks, Tim. Yeah, sorry, I see a wee question in the chat just from, I think it's from Emma from MCCT, North Coast Community Transport. Emma, it's just a wee typo there. Well, the drivers are particularly concerned. I assume that I'm not quite sure what your question is. Do you want to just come on and ask it?
Hello. Oh, hello. Can you hear me? Hello,
yes,
can you hear me?
Hi. Yes.
Yes. Sorry, I'm a bit bashful in these things, but it was really just kind of reiterating the thing that Patty had said, and a lot of our drivers had shown mentioned a big concern. It was more to do with the minibuses, but how they clamp in wheelchairs, because there's a lot of close contact needed for like putting straps round. They're very, very close to them and that. And any drivers that I'm talking to, it's one of the kind of primary concerns that they have, and how we kind of do that. So does that mean like electric wheelchair users are not going to be able to be transported for a while, or
Well, I'm sorry, I would get your comment. That's really good. I'm not sure whether you want to come back on that, Tim, or whether Malcolm has any thoughts. I'm thinking really more about the social car scheme.
I think
yes,
it was something that was really challenging for us, and that's why for the voluntary cars, we went down the route of the CHU and the PP and doing the bubble, because then it minimises the amount of different people that the patient and the driver is exposed to. I'm very conscious on a bus service that's probably not really applicable, but the bubble was one way around that. We have this issue even on our ambulance transport.
Okay, yeah.
Could you mute, please? Sorry, when Malcolm's speaking. Sorry, Malcolm, carry on.
We have this issue, and it really is PPE, and it's when you're pushing the wheelchair in, and if you approach it from, it's about minimizing the risk, and and the different degrees of that. So, for example, if you put a wheelchair in, stand behind whoever's in the wheelchair, using a mask, putting a mask on the patient just to get through, and then gloves, and then just approach the wheelchair and hook it up from the back as best you can. I realize there's clamps that have to go on the front, but you can do them from the side. So that's what we sort of did. But it's, again, for that close contact, the key message there is that's a very short time. So it's about minimizing the risk. So it's about using the gloves, using the mask, in and out quickly, and that's how we sort of manage it. And then if there's somebody in the back, and with that, if the vehicle's big enough, we try to maintain the 2 meters in the back of the vehicle, but still, while everybody's in the back of that vehicle, it's using masks and any other PPE that's available, and again, minimizing. I don't know if that's any help or not, but that's just what we do.
Tim, do you want to come back on that? Sorry.
Wheelchairs, just to come back a little bit Emma's points, with wheelchairs, I think it's the person's facing away from you, and if you've got PPE, if the driver's wearing PPE and there's adequate PPE on, the risks minimise with them facing away. And also with wheelchairs and with clamps, it's about cleaning them before and then after use, and the wheels of the wheelchair. So it's getting the person onto the vehicle, performing some cleaning, ensuring that there's proper grade PPE that's being worn by the driver, and the risk is very much minimised then with the wheelchair. Now, in terms of a car scheme, obviously a car scheme is not going to be carrying somebody in a wheelchair in the car, a regular wheelchair user. But it's about that's why if there's somebody with limited mobility that would normally be able to walk to the car with assistance, if they're in the wheelchair, then they're facing away from you. And if the driver in the volunteer car scheme has proper PPE on, they can then wheel the person to the car, and then contact is minimised, and getting that person from then their home into the vehicle, and then vice versa. So I think it's about reimagining services, and it's about really communicating well with your staff, with your volunteers, with your passengers, that things are going to have to be different, and it's not what people want, but it's communicating in a way that people understand, to ensure that they know that they're going to get in and out of the vehicle safely.
Yes, thanks, Tim. I think that we're coming back to a new normal where normal isn't what we expected it to be, unfortunately. Rosie, good morning. I saw your hand up there. You had a question. You're on mute. Do you want to unmute yourself?
Sorry, good morning. I think the question I had has just been answered very well by Paddy and Malcolm and Tim as well. The use of wheelchairs, something I never thought of. It's absolutely brilliant in terms of our patients coming in. I think the only thing that I can think of is in terms of we are taking patients into one of our own facilities in Newry, but in another facility in Dungannon, for instance, the facility isn't ours. So while we can control the cleansing in the car, etc., again, we have to be very mindful of the facility that we're actually going into. And again, I think it's a sense of trust that the cleansing has taken place in those. I'm just thinking of, entering a building, going into a lift, but I'm guessing the likes of the PPE being kept on throughout that process will answer that as well.
Do either Tim or Malcolm want to come back about that? Because that's a real issue if you're taking someone into an outpatient deployment or something like that.
I think there is the aspect of trust, and it depends on the facility, but I think it's also having a discussion with that facility. Things we had to do was actually sit down and, what are the arrangements, and where you used to not have that discussion, you really need to have that discussion now. Are they cleaned frequently? What is your cleaning regime? What's happening in that facility? Little things like, we give out the wipes so that actually, if somebody's guiding somebody in, they can wipe the handles down first. The person is actually bringing them in, using the gloves, etc. But it's about really having that discussion. And with the wheelchair, where it's like ourselves, we had people that were in cars that, even though they didn't like it, we had to put them into the larger vehicles. We had to put them in ambulances, because that's the only way we could manage it, the risk at that point. So it really is all of those things.
Thank you.
That's great. We're just coming up to 12 o'clock here now, so that's our kind of finishing time this morning. I just wanted to check before we finish, has anyone else, I see one more question has popped into, that's just Jane saying about new volunteers. I was going to come to that. Has anybody else got another question for Tim or for Malcolm? I'm just looking along the line to see if I can see any other hands up. No, we're okay. Great. Well, look,
can I just say something? I think one of my old teachers is a participant here, and I'm very disappointed he didn't ask a question. So, Mr. Orr.
Mr. Orr, it's all coming out now. Tim, good job you with your best behaviour this morning, or you'll be getting your knuckles wrapped.
Because when I saw him the participant list, I was going, oh my goodness, this is now This is me dead. My credibility's gone. He's going to get his own back.
No, I'm still here. Yeah, you're doing a good job there, Tim. Great to see you there.
That's really lovely. I'm just going to take this opportunity to say a big thank you to our speakers this morning, to Tim and to Linda and to Malcolm. It's really, I think we're at the beginning of this journey in many cases, and I don't think we have all of the answers for things, but I think it's trying to take the spirit of the can-do and trying to see how we can make this work. And I was inspired by the ambulance service approach of how they've risk managed and done it step by step and slowly thought about reintroducing services. I suppose my takeaways from this morning really is about focusing on that training and cleaning, and then also the destinations that we're taking people to, and just having those discussions with them. Malcolm, if you have information sheets that you have sent to drivers about hand washing and decontamination of vehicles, it would be great if you could share those with us, and we'll share them with the rest of the participants, if that would be okay. It's all quiet. It's gone quiet. So hopefully I
was giving you a thumbs up there instead of coming back.
I can only see about 5 people. This is very difficult to do. Thank you. We'll pass those on, and if you're happy as well, we'll share the notes that you sent through this morning as well.
Yeah, okay, no problem.
Great, lovely, thank you. So Jane has also just put in the chat to say that we have had a large number of people come forward to volunteer over the last number of months, and there has been a huge interest in volunteering, and we do realise that some of your volunteers will not be in a position to return to volunteering at the moment because of their own health issues or their age, or whatever the issue is. So it's just to remember that you can put an opportunity through to Volunteer Now, and we can help you promote that, because you may need to recruit some new volunteers, especially if we're thinking about that bubble, and so volunteers are more limited in how many people they can actually drive. So look, thank you for joining us this morning. We really appreciate the time that you've taken. We'll put the recording on the website in the next day or so, and we'll circulate the information to the participants. But thank you again to our speakers, Linda, Tim and Malcolm. Thank you everybody, and keep safe. Bye-bye.